Recording in progress. Hi, Kate.
Hi, Cheryl.
And how are you today?
I'm really well, thanks very much. It's very grey and miserable outside in the UK. It's been like this for days and days, but I'm here and life is good. How are you?
Very well. We've had a streak of sun and unseasonably warm weather, which in Canada we'll take.
Yeah, life goes on.
Absolutely. Listen, let's welcome everyone to season 2 of our little YouTube channel. And I was having some thoughts and I discussed them with you prior to hitting the record button. And what I think I would like to discuss with you is the difference between food addiction and harmful use. And that's precipitated on a conversation that I had with someone who felt very much that um, moderation was the solution to anyone with a food problem. That basically there was no such thing as a food addiction, that was a mind over matter, and you just had to deal with your emotions in order to make peace with food. So we had an interesting
Mm.
conversation, and I was wondering how you felt about her stance.
Oh, what an interesting conversation. And that's
It
so
was.
like you, just to really join in and really open up the conversation and the debate with people. Because, whenever I hear that thing, mind over matter, I think, I don't mind and you don't matter, it's
There's not.
around that. So I'd be very, very wary about that. I think what would be really helpful in the first instance is, and you're going to hate me for this and you're going to shout at me after we finish recording, put you on the spot and say, what does moderation mean?
Yeah, well, what does it mean to what it means to me and what it means to you and to someone else is completely different. So moderation, I believe what she was getting at was that, you could have a little bit of this and then put it away. Like most people can have a little piece of chocolate and put it away. Well, I can honestly tell you that for a food addict, one little bite of chocolate and you are face first into the whole bar and then shopping for more. There's a big difference.
Mm. You've really hit on something for me. This topic is so live and so prevalent and so very real at the moment. There's a lot of social media, a lot of influencers, a lot of people out there who are really wading into this whole area of food addiction, although you and I specifically would call it sugar addiction, an
Mhm.
addiction to highly processed food, not a food addiction per se.
Correct. Right.
With that. But a lot of people are wading in there and really muddying the waters, which I think is actually quite dangerous, in the sense that it leaves people with the impression that they can consume a little bit of something at some point. Now, I'm not sitting here saying that's never going to be possible, but I would never start on a premise for treating somebody who has an addiction to sugar with the idea or the notion that you can moderate. I mean, my experience has been very much 3 years into this, that whenever I go back and believe that myth, it's like the pink unicorn myth and all the rest of it, I'm heading into danger, into dangerous
Mhm.
waters, and it hasn't served me well as a
Right.
premise.
Right. Yeah. It's quite interesting, this moderation thing for someone who is addicted to sugar and highly processed food, because what happens every time someone who is addicted tries moderation, they inevitably fail. And what comes with failure? Shame. Um, just feeling like you can't manage and everybody else can, and what is wrong with me? There's nothing morally wrong with you. You're just wired differently. So moderation won't work for someone with an addiction. Addiction is a compulsion. It's all consuming.
Mhm.
For someone with with sugar addiction, with Christmas coming up, they've been thinking about Christmas and all the goodies since October. A normal person couldn't care less if they showed up on Christmas morning and there were no goodies under the tree that were food related. But for someone with a food addiction, that's all they can think of. The baking, the grandma's best pies and the chocolates that are under the tree. It's in your thoughts all the time.
I think that's what defines it for me as an addiction. So it's that compulsion, it's that obsessional thinking, it's that I know I've got a piece of something in the fridge and I can't stop thinking about it and will not be able to stop thinking about it until I've eaten it. And I continue to eat despite knowing it's going to have negative consequences, that
Mhm.
I'm going to continue with the symptoms that I'm experiencing. It's just going to keep me really stuck in that loop. And for me, when I was really in the midst of my sugar addiction, those symptoms I was experiencing was the compulsive thought. It was the food crazes. It was the always planning when I could have my next hit. My life was absolutely consumed by the idea of consuming.
Mhm.
And also, in terms of the negative consequences, I was struggling with a plantar fasciitis in my heel, lots of joint pain, joint inflammation, tremendous brain fog. And I
Mhm.
knew that the food I was eating was really contributing to what I was doing, but I was not able to stop what I was doing. However, when I began to build up some education and knowledge around what was happening and what was happening in my brain and what was happening in my body, that gave me the ability to start making different choices around what I was actually putting into my mouth. And with that came freedom and relief.
Yeah.
It's, I mean, I don't know, does that sound familiar to you? Did you have those similar experiences?
Yes, absolutely. The other thing that came with everything that you described, and that was me spot on, um, is, I mean, I was behaving completely contradictory to my values. I was lying to people. I was hiding. I was doing these things in secret. And you don't feel good about yourself when you're behaving against your values. I'm not a liar. I
Mm.
don't cheat. I don't sneak. But I was doing it with my addiction, you know?
But that's so, when you say that and you share that, that's how I deeply know it is an addiction, because those are all symptoms of an addiction, no matter how it shows up in life. So whether or not it's an addiction to sugar or the highly processed food, or whether it's addiction to porn or gambling or alcohol or smoking, or all of it involves to a certain extent this sneaking or this hiding or this lying behavior around it. It's part and parcel of addiction, which is why I know so strongly that what I was struggling with was an addiction.
Mhm.
Also because addiction is one disease but with lots of different outlets, and that was very much prevalent and evident in my life. So I was struggling with an addiction to sugar. I was also struggling with an addiction to work. I was struggling with an addiction to over shopping. I was struggling with addiction to, so over and over, it would show up in different ways in my life, which really, to me, is self evident that there is a neuroadaptation. There's something going on, excuse me, in my brain
Mhm.
involving something.
Right.
And
You're
we know that something now to be the red dog, to be the faulty wiring in our brain caused
Yeah.
by the dopamine reward system specifically being hijacked by an entity that we
Mhm.
term red dog.
Right. Yeah. Um, the person I was speaking with, she said that for when she works with her clients, um, she recommends working on the the behavior, the thoughts, the feelings, and food will just take care of itself. When in fact, we know that as long as you're in the food, that's making you, that's keeping your life off kilter, you can't work with those feelings and emotions and decision making. You're in this fog that is really difficult to cut through. And it's only until you can stay out of the food long enough that you get some clarity and you can get a little bit of traction that you can start working on, you know, changing your behaviors. But you have to address the food first and then deal with the emotions and the the history or whatever's going on.
So we both offer a diagnostic process, which is the sugar assessment, which was created by Bitten Johnson and Börje Dial in Sweden. And we use this primarily to determine whether somebody is a social user, a harmful user, or has a full-blown addiction to sugar. And there's a reason why we do that, which is that if you are a harmful user, that is someone who usually is an emotional eater, who usually has a why behind why they were eating, and
Right.
for whom symptoms will respond well with maybe a talking therapy, with maybe just space to discuss the stuckness or the stressor point or something that's going on in them that's affecting them,
Right.
and can give you a why when you ask
Right.
them, which is usually spot on. They know very much why they're eating. I just eat because I'm worried about this and it distracts, whatever. There's a why and
Right.
there's a reason around that.
Right.
That is one category of user, and that treatment-wise will respond really well to moderation. It will respond to the Weight Watchers and the diet clubs and the everything else that goes with that. But this is the reason why we have to determine when we start out on a coaching program whether someone is a harmful user or has a full-blown addiction, because a person with an addiction, moderation is never going to work.
Right.
Do you want to expand on that a little bit?
Well, it's just like it's like being an alcoholic. If a person has a week of not drinking, but then on the weekend has a beer, well, the next day they're going to be having more beers and more wine and all of that. You cannot have just a little bit. It activates everything in your brain that keeps you in the loop of addiction,
Mm.
you know?
I always think of it, in simple terms, which is the way I work, poking the bear. It keeps poking the bear, doesn't it? It comes
Right.
back and roars,
That's
and
right.
leads to more overconsumption around that. I mean, so this is really why we start out at the beginning. I know both of us have adopted this system when we're working on our coaching, is to define, is it an addiction or is it harmful use? And if it's harmful use, we'll hug you and love you and say, great, go on your way, because you will be successful with
That's
moderation. It
right.
will work for you. But if it is an addiction, moderation is never going to work. We need to start off from a point of abstinence and one day at a time, and bringing in all those other recovery principles that have worked so well. There's 100-year tradition of working through recovery in Alcoholics Anonymous and all the other anonymous groups and recovery groups around that, and bringing all that learning and knowledge into what we have, learning ways to really calm the inflammation in the brain that's been caused by the sugar as a
Right.
psychoactive drug, and then bringing in all those practices, learning about the triggers and cues, relapse prevention, hidden warning signs, all the work that we do together to help you really address the addiction, understand what's going on in the brain, and move forward from that place. But it's hard.
It is. It is. But it's also doable and it's also hopeful. It's not getting a diagnosis of having an addiction to sugar and highly processed food is not doom and gloom. It's a good thing. Now you know what you're dealing with. I had my client, young person, slim, trim, looks very healthy. Unfortunately, she has a whole bunch of digestive issues, and she's still using sugar and highly processed foods, even though she has all of these health consequences. So right there, it tells you that, she's an addict. Anyway, so we did the sugar assessment and she was off the charts addicted to sugar and highly processed food. And she said that she was so relieved to finally know what it was that she was dealing with. She knew now that she could go forward. And for her, it wasn't a negative thing. It was a happy thing. And I find that most of my clients feel that way. They know what they're dealing with. Okay, I'm not crazy. I'm not a failure.
Mm-hmm.
There's nothing wrong with me. My brain is special. I'm very good at finding food.
I know. And actually, I repeat that over and over again. That is what clients reflect back to me. And actually, I can really empathize with that, because for me, it was just a profound, enormous sense of relief. This is what it is. And this is what I'm going to have to do, I suppose, to get control of it, to get my life back into control, because, it had felt very chaotic. That's one of the things that the addiction brings with it, a sense of, well, for me, just really chaotic living.
Yeah.
and I wasn't
Yeah.
comfortable living there.
No.
It it
No.
it, it somehow telescopes life into downwards into something very small and a
Hmm.
very very narrow existence,
Yeah.
and then realizing that actually it is not me. I am not broken. I have this, like you say, it's just a pattern of super sensitive brain, super sensitive to sugar, and
Hmm.
it's being triggered time and again
Hmm.
by that. It just made a huge difference. And both you and I coach hope. That's what we're in the
Yeah.
business with.
That's right.
We're walking the path with you. It's not that
Yes.
we believe anything other than, or saying you do this or you do that. I think for both of us, well, I know for me, is just to inspire others into a life of recovery, a life beyond the addiction, a life where we get to play and have fun and feel free and not completely pulled all the time to getting the next hit. I mean,
Hmm.
anybody who comes to it and says that it's not addiction, I think probably isn't an addict and probably hasn't
Right.
had the experience of it being a sugar addiction. What would you say to that?
I agree. If you haven't experienced these compulsive thoughts and these these moments in that completely consume your life, you have no idea. So moderation makes sense. Hey, just have a piece of one slice of cake. Okay. Good on
Mm-hmm.
you if you can do that. I can't. I mean, I can, but then I'll go home and eat everything in sight when there's nobody around to make up for what I didn't get to have, you know. So, but the other thing I want to touch on is when you are in the addiction, you cannot see outside of the addiction. I couldn't possibly live my life if I can't have chocolate. What would be the point of living life without cake?
Mm-hmm.
Food brings me so much joy. It's the only thing that brings me joy. And you absolutely 100% believe this to be true. Absolutely. And it's a little truth. It's a little truth. But the big truth is when you are outside of the addiction, life is so much better. It becomes clear that it's not just about food. Food is not the only thing that brings joy. When you're out of the food, there are so many other things that bring joy and contentment and fulfillment, you know?
I do know, and if anybody's to take anything away from this discussion we have with each other, I think it would be for me exactly that. Part of the problem with the sugar as a psychoactive drug is it causes biochemical brain fog almost. The response that it has in your brain obscures the ability to see beyond that. So that's
Mhm.
part of the reason why you have to get the toxic drug out of your system so that you can start to get out of the brain fog and out of the confusion and actually begin to see the truth. And the
Mhm.
truth is not me on sugar.
No,
That is a case of mistaken identity
absolutely.
at one
Yes.
level. And it's such a gift to suddenly
Mhm.
start to be able to see that with clarity caused by
Right.
detoxing from the sugar
Mhm. Mhm.
and daring to move forward from that place.
Yeah.
The reason I say it's hard is because for me, the addiction is the only disease that really you need to be told every single day that you have it. It's very easy to talk yourself out of it. And which
Mhm.
is why it infuriates me that the message is really being diluted by influencers and social media people who seem to have jumped onto the bandwagon as this being the latest thing around that, and to have moved it to bring all that diet mentality into the addiction piece. Whereas our protocol, our recovery protocol that we work to is very much 10% about the food,
Mhm.
40% about addiction knowledge and education, and 50% about community support, knowing that you're walking shoulder and shoulder within a community of people who want something different for themselves and
Right.
believe that something different is possible, and not only possible, it's desirable. So the
Right.
food makes that such a small part of the recovery protocol. However, if you're not in a position where you're walking past the food on your journey, then you're going to be stuck looping in that place.
Yeah, absolutely agree with you. Absolutely agree with you. So, what do you think, and I'm just throwing this out there at you, what do you think keeps people from getting help? People who struggle with food, I mean, maybe they've heard of food addiction, maybe they haven't, but they have definitely been yo-yo dieting and they keep failing and they try again and they keep failing. They're always back in the food. And food is not just sugar, it's anything that converts to sugar when you eat it. So your pasta and your bread and your flour and all of that. What do you think keeps people from seeking help? Is it
So
because,
I think
yeah,
I'd say on a sort of biological and physical level
mm,
that for me it would be people's perception of abstinence
okay,
and a sort of panicky feeling
yeah,
that's induced when this concept of mother's little helper isn't available in the moment to distract people from what is often a painful reality. And I I was talking to a friend yesterday who's carrying some extra weight. She said she was absolutely desperate. She said that she really didn't feel she could carry on living this way. She tried the weight loss injection for a month and had
okay,
found tremendous relief from the food noise and the craving and had lost a stone in 3.5
wow,
weeks. But she couldn't afford to continue. And she
right,
was seeing the weight go back on and was beginning
yes,
to feel utterly desperate, only because she had touched what had seemed like a silver magic, magic silver bullet to make a change. The
right,
desperation was coming back on at a faster rate and at a deeper
yes,
level. And I talked to her a little bit about the changes that I'd been able to make and about
mhm,
not doing it alone and about there being a huge community of people who were there wanting to support and walk with her.
mhm,
But it came back very much to her, I think, a deep realization that to step onto that path is to embark upon a journey, the destination of which is uncertain. And for a lot of people who are currently feeling very uncertain in this day and age, being able to pick up a bit of something, something, and have the certainty that that's going to bring immediate relief from what can often feel like a painful reality. And the concept or perception that to walk a life of abstinence is to become a monk in sackcloth and ashes or whatever, the choice feels something easy to bounce off and put further down the road because it feels too difficult a choice to make in this moment where I need the certainty of my best friend,
right, yeah.
which is the trap, I guess.
That's right. Exactly. Exactly. Too, there's a lot of shame around addiction. When someone is labeled an addict, there's always this thing, these thoughts about being out of control, being labeled as less than or um, morally or just not being a very um, confident person and just feeling like a failure. And I think the label of addict is maybe keeping some people away. They may suspect they have an addiction, but they don't want to be known as an addict. I don't know if that plays into it.
It's interesting, isn't it? I think that the word addict is really interesting. A lot of people, certainly myself, have a perception of somebody being, on the side of the road under the bridge in a cardboard box and all the rest of it, having walked away from society and walked away from, abandoned all of society's structures and morals and something that's not very desirable. But I think, for me, I had abandoned me. in the addiction. So I do resonate with that, although I don't call myself an addict, because I think to label, if you have cancer or something like, you don't say I'm a cancer. So there's a semantic debate and a point around that, but it's helpful for me to witness what I have as a disease, as a chronic disease, which does not define me. And I know you and I feel so strongly and passionately about life beyond addiction. We've had this debate over and over and over, how people can feel confined and defined by that, but actually, ultimately, it's very freeing.
Absolutely.
It's
Yeah.
very freeing as a concept, because now you know, oh, that's what it is, and you can make decisions around that.
Right. Once you know, you can't unknow, and then you can make the right decisions or learn how to make the right decisions. Yeah. I think too, um, I think people are afraid of how it will look to others when you, I don't know, let's say you go to your family's dinner and you're known as, the one that eats the desserts and you're the foodie and you love to cook and what will people think when I don't eat that way anymore? And I'm no longer cooking these big pasta dinners with the homemade bread and how will people perceive this new me? And how will I perceive this new me? I think there's a bit of that going on too. Like, what will people think? We care a lot about what people think.
Because a huge part of these sort of community and family events just are really oriented around food and what's on the food. And really, we just have to learn techniques. And that's part of what we do as well, the role playing and almost like the dress rehearsals for these scenarios of how to actually be in that situation and not to be about the food, how to get the love, how to get the joy from the conversations, from the
Mhm.
connections, and I know in the past I've been to buffets and things like that where all I could do was stand by the table and, think I wasn't paying attention to the conversation that was going around the table. I was
Oh,
literally just thinking about what I could next on my plate. It was as compulsive as that.
yeah,
And just missed the connection, missed the love,
yeah.
which was crazy in a way, because it was the connection and love that I was longing for, but I'd mistaken it for the food. I'd
Mhm.
mistaken
Yeah,
all that love. I'd mistaken all that connection for what I was putting in my mouth. And it's, learning that and learning to focus on the people as opposed to what's on the table in front of us just makes a profound difference. I mean, I know you mentioned that a technique you'd heard of where somebody had, what was it? They had a plate of food. Tell me that story because I love
yes.
it.
One of my clients was so happy to tell me that she comes from a very large family. There's 100 of them, and 60 of them got together for a post Thanksgiving, pre-Christmas family gathering, and they rented a hall. And of course, there was a ton of food there. And she has a very, very supportive family, a very supportive husband, and two children, ages 15 and 11, who know that, mommy has health issues and mommy can't eat certain things. And anyway, so they go to this event. Everyone knows about my client's health issues and about her, failed attempts at various diets. Anyway, so she doesn't tell anyone that she has decided to just eat carnivore. So for her, abstinence from everything right now is the proper way to go. Anyway, so she goes to this dinner, enjoys her family tremendously. It's time to load up the plate, and she loads it up the way she normally did. She added a little extra turkey, mashed potatoes, carrots, and peas, and her family loaded up on their plates and sat at the dinner table. And she was able to eat her meat. Her husband would scoop her potatoes and eat her potatoes, and the children, this just broke my heart. It just made me feel so nice. Her children were picking at the peas and the carrots, so no one would notice that she was not the one not eating those foods. Isn't that wonderful?
No, I just love that story
Yeah.
because it feels so nurturing and loving and supportive and held within the family on that space around that table. And that's exactly what I'm arguing for.
Mhm.
To allow for ourselves the possibility that there is more than the food and that we can find and that we deserve those connections around loving and belonging and feeling that we're enough and having that support and
Mhm.
deserving of that support. And those are the things that perhaps for some of us I don't know, there's been a sense of lack, a sense of it not being present, and feeling like discomfort and pain around that. And it's been easier not to feel those feelings and not to embark on a journey of that self-compassion and self-loving, to find the answers to those bits that we feel are missing from us beyond the food.
Yeah.
But
Yeah.
I adore that story. I mean, contrast
Too.
that with me and my, oh my goodness, my boss at work, and being at a buffet round the table with that, just waiting and having a plate of food, and him walking past and saying, "Oh, Kate loves her food," and in front of everybody, and just
Oh,
the intense shame that I felt.
yeah. Yeah.
There's this thing was like burning through my hand, this plate pile. Oh, Kate loves her food, and to have,
Yeah.
utter shame
Yeah.
on that.
Yeah.
And just, yeah, just to contrast that with that beautiful loving story in the moment shows what's possible. And there's all sorts of
Yeah.
ways and techniques, aren't there, of protecting ourselves
There
in that
sure are.
scenario.
There sure are. Kate, always a nice, pleasant conversation with you. Always.
Well, we do take a deep dive, don't we, into some of these subjects and stuff. But you know what? I really want people to, you know, not to dilute the message around
Yeah.
addiction,
Yeah.
because it's that changed my life after a 45-year history of yo-yo dieting and believing that I was broken, and everything that flows from that. And that's why it's so important to me.
Yep. Yep. Same here. Same here. Yep. Thank you so much.
We'll see you next week.
You bet. I wonder what we'll talk about.
We'll have to have another discussion. It's great to see you.
Absolutely.
Take care.
Take care. Bye-bye.
Bye, everybody.
Bye. Now, how do I stop? There we go.